to you. I'm Dr. Ringu Teresa Jose, consultant psychiatrist in Lourdes Hospital. Today, September 10, is adopted as the World Suicide Prevention Day under the aegis of the International Association for Suicide Prevention. Currently, 1 in every 100 deaths all over the world is because of suicide. It is a devastating condition which brings despair and misery not just to the individual who attempts or commits suicide, as it also causes distress for the people around him. This year's theme, Creating Hope Through Action, focuses on the fact that suicide is a preventable thing, and to inspire everyone that through our actions, big or small, we will be able to prevent suicides as well as give hope and support to those who are undergoing a suicidal crisis. On this Suicidal Prevention Day, let us talk about the complex phenomena which constitute suicidal thoughts. Initially, suicidal thoughts come from a jumble of emotional upheavals such as despair, helplessness, and hopelessness. People often feel that nothing good will come out of them and the future is bleak, and it is often considered to be a release to die. From these feelings, death wishes take root, in which the person feels that death is an alternative, pleasurable outcome to continuing to live. Often, intense anxiety and agitation can combine with these feelings, making death seem like a peaceful solution. Following this, thoughts as well as imagery of dying would be converted to thoughts of ending one's life. After that, based on one's age, gender, access to content which shows suicide like social media or movies, as well as the personality traits, a person would move from getting thoughts to planning or a suicidal act. Some people at that time would impulsively act out at a stressful moment with whatever means they have, while some people would take time to make a suicidal plan, a suicidal note, or a letter. As these thoughts increase in intensity as well as duration, the person becomes more focused on committing suicide. In the current era, some of the newer phenomena we're seeing is people who have suicidal thoughts visiting suicide chat rooms or searching the internet intensively to find out how to commit suicide. There are also a lot of reports of younger adults and adolescents making plans and telling their friends about live streaming similar episodes. We will now discuss what are the conditions that usually act as a trigger for suicidal thoughts or suicidal actions. We find that everyday stresses such as divorce, relationship breakdowns, financial problems, academic failures or academic difficulties, social bullying or trolling, difficulties in communication with your peers, traumatic events such as sexual or physical abuse, accidents, chronic illnesses, especially the ones which have a painful or a disfiguring sequelae, are the ones which commonly lead to suicide. It has been noticed that in a significant proportion of people who attempt or think about suicide, they also are suffering from mental health conditions such as depression, substance use disorders like alcohol addiction, drug addiction, behavioral addictions, post-traumatic stress disorder, as well as chronic psychosis. Another group of people are people who have personality vulnerabilities, which make it difficult for them to handle most of the common day-to-day stresses. And suicide is often a coping mechanism when things become too chaotic for them. A special mention in this COVID pandemic era, where either fear of the disease or fear of dying after contracting the disease can lead to intense agitation and anxiety that also could trigger suicidal thoughts. Now, what do we do if one of our loved ones, family or friends are experiencing a suicidal crisis? The most important thing for you to do is spend time with them immediately and then. Do not postpone it. Sometimes keeping a vigil with them is the most important thing, as suicidal thoughts and impulses are often time bound, and as you spend time with them and support them, they will gradually decrease in intensity and duration. Communication is the key point there. While you communicate, make sure that you give more time to actively listen to them. Help them to vent out their feelings and frustrations. Show a non-judgmental, accepting attitude which helps them to validate their emotions and feel more reassured. Do not try to argue or debate with them or try to advise them at that point. It is important for them to know that we do understand and accept them as they are. The next important thing is also to ensure that you can remove the means to commit suicide. For example, sharp objects, medications, poisonous substances from their immediate surroundings, as this would reduce the danger of them acting out impulsively. Most important of all is, once you have calmed them down, is to ensure that they access mental health support at the earliest. Mental health professionals are equipped to handle all the triggers that we have discussed earlier. They are trained through both psychotherapy as well as medication to help people to change their emotional upheaval as well as develop healthier ways of coping and handling their crises. Suicide helplines are another common first aid that is available in almost all major cities to handle the issues as they happen.